Okay, well, welcome everybody. Welcome to the conversation series on urban trees as an essential aspect of urban health. We're so happy that you've been able to join us today. My name is Rhoda DeYoung. I'm the director of the Plant Responses and Environment Program at Vineland Research and Innovation Center. And I'm so proud to be leading the Greening the Landscape Research Consortium, which is hosting this two-part series. So if you missed the first part, it was with Ed Gilman and Deb Hilbert, and we talked about the importance of proper root structure in young trees. For those of you uninitiated, the Greening the Landscape Research Consortium is a collaborative group of different members of the urban tree value chain. So like the tree nurseries, the landscape architects, urban foresters, landscapers, product suppliers, substrate suppliers, among all others, who take part in caring for our trees from the time that they start their teeny tiny adorable lives all the way to being the big behemoths we see on the landscape. The consortium works together to build the collective capacity of the urban tree value chain by sharing and developing scientific knowledge, such as we're doing today. We have our consortium members to thank for choosing the topic for today and many of the questions that will be asked. So if you are a member of the consortium and you are here in the audience, thank you. Before we begin, I want to take a moment to express our deep appreciation for the land on which we host this conversation series. Our research center, if you've not had the opportunity to visit, is a remarkable place. Please reach out and visit. I love showing people around. But it's built upon this very unique landscape that's been essential for people for millennia. And these are the shared lands, the shared traditional lands of the Anishinaabe and Haudenosaunee, many of whom continue to live and work in this territory. In all our research and activities on this land, we aim to engage in actions that show our respect for the land and in the work of Indigenous rights. This event is hosted in collaboration with ISA Ontario, so the International Society for Arboriculture. I'm proud to serve as the VP of the board. And if you are an ISA member looking to collect CEUs for the session, just remain in the webinar for the whole duration of the event. You don't need to type in your ISA certification number here or anything because you've already done so with your registration. At this time, I'm very pleased to introduce you to our moderator for the session. She's a friend of the team and an excellent person, Dr. Nadina Hale. Nadina works in this really unique intersection of technology and urban nature. And in fact, we were lucky enough to have her as one of our expert guests in our conversation series last year. So if you want to learn more about Nadina's work, you'll have to look back and listen to the recordings that we had from last year. She is the one who coined the term Internet of Nature, which refers to using innovation to make communities greener, healthier, and more resilient. She hosts the Internet of Nature podcast, which is an awesome listen, highly recommend it, and is the author of The Nature of Our Cities, a book that if you subscribe to the Ontario Arborist magazine, I did do a little review of it last year. The mic is yours, Nadina.
Thank you so much, Rhoda, and thank you to Vineland for having me back as a moderator this time. It's such a pleasure to be here, and I just love working with the Vineland team. There's so much incredible innovation happening in all aspects, but especially what's going on within the urban forestry and arboriculture teams is so exciting. So thank you for having me. I'm really looking forward to the discussion today with guests that are on the leading edge of something that I think is still somewhat under highlighted when it comes to urban forestry, and that is its impact on public health. We've talked for many years, right, about all of these incredible ecological benefits that trees provide, whether it's how much carbon they sequester, how much oxygen they provide us with, how much particulate matter they soak up, how much rainwater, all of these, incredible benefits. But we have the privilege of talking to two leading researchers when it comes to the impact on public health that the urban forest provides, which I'm so excited to dig into. I just wanted to note that we do have a lot of people registered today, so we do not have the chat function enabled, but we will be sharing any notifications via the Q&A, and we also welcome you to please submit your questions through the Q&A function as well. So before we get into the conversation today, I want to introduce you to our wonderful guests. First up, we have Dr. Matilda van den Bos. She is an adjunct professor in the School of Population and Public Health at the University of British Columbia. She's also a senior researcher at both the Barcelona Institute for Global Health, IS Global, in Spain, where she's calling in from Barcelona today, and also at the BioCities faculty of the European Forest Institute in Rome and Italy. She's trained in both medicine and landscape planning and public health. So talk about a fascinating combination there. Dr. van den Bos studies how environmental exposures, in particular natural environments, affect human health, including childhood development and public health impacts of regulating and cultural urban ecosystem services. She has collaborated with international organizations all around the world, including the World Health Organization, the UN Environment Program, the US Environmental Protection Agency, and Health Canada. And she was the lead author of the Oxford textbook of Nature and Public Health, which came out in 2018, which should probably be required reading for anyone interested in this webinar. It was actually the first textbook that was published on the interconnections between nature and public health and human health. And then, of course, we have Dr. Jeffrey Donovan. He received his PhD in forest economics from Colorado State University in 2001. He then worked for 23 years as an economist for the USDA Forest Service in both Alaska and in Oregon. Currently, he is the owner of Ash and Elm Consulting. That's a great name, Jeff, which is focused on making the business case for urban trees. And his primary research focus has been quantifying the benefits of urban trees. For those of you interested in this topic from an academic perspective, I've no doubt run into the research by Dr. Donovan. These have ranged from intuitive benefits, like reduced summertime cooling costs and increased home values, for example, to less intuitive benefits, such as crime reduction, and we'll get into that. He has worked extensively on the relationship between trees and public health, finding that mothers with trees around their homes are less likely to have underweight babies. And when trees are killed by an invasive pest, more people die from cardiovascular and lower respiratory diseases. And currently, and I think this is fascinating, he is focusing on how exposure to plant diversity may protect against a range of immune diseases. So we have two wonderful guests. So we are just going to absolutely dive right in. What do you say, Matilda and Jeff?
That's great.
All right,
Great.
Wonderful. So when I was preparing, in high school, deciding what to study, I initially wanted to get into journalism. Unfortunately, journalism school did not accept me, so I had to come up with a plan B pretty rapidly. And I always loved the outdoors, so biology seemed like a wonderful plan B, and I'm so glad I chose that. But so when it came to choosing what exactly I was going to study in terms of biology, you kind of had two options at university. You were either going to study ecology or you're going to study human biology. And it felt at the time, 15 years ago, there was this very clear divide. But you have both mentioned to really kind of combine these really interesting disciplines and combine this idea of, the study of medical research with urban forestry as well. So Jeff, let's kick off with you. Would you please tell us about your areas and how you got into this domain, looking at urban forestry and its impacts on public health?
Yeah, absolutely. So I'm interested in the impacts of trees on health sort of across the life course, because you see those benefits across the life course. So from the impact of trees on birth outcomes all the way to longer life, right? But also, one of the things I'm not just interested in, we often in this research treat trees like widgets. More trees are associated with better health, but also trying to understand whether the diversity of trees matter and how that can affect our immune system, particularly the immune systems of young children. So really, and also then just looking at innovative ways to study trees and health, because as you all know, we have that problem of greener neighborhoods also have higher socioeconomic status, and trying to untangle that sort of three-way relationship between trees, demography, and health. So I'm always looking for sort of new ways to revisit old research. So that's what I'm doing.
Fascinating. And Matilda, how about you? How did you get into this? I mean, you studied medicine and landscape planning right off the bat, so clearly you've been combining these two for a long time.
Yeah, thank you, Nadina, and thank you for inviting me to this conversation today. It's fascinating to be here. Well, yeah, no, really, my background is, as you say, in medicine, and it really, the reason for changing career was that it really grew out of this thing that I was working in a hospital and I saw the patients suffering from the kind of diseases that we couldn't do much about, like were clearly related to lifestyles and the surrounding environment and so on. So that's when I got more interested in preventing people from coming to the hospital in the first place, and promoting health through particularly exposure to natural environments. So first I worked at the Swedish, I got a PhD then in landscape planning at the Swedish University of Agricultural Sciences. And then I moved right to the University of British Columbia, where I studied mostly neurodevelopment among children. We used the early development instrument, which is distributed to all children at the age of 5 to 6 in Canada, and linked that to the exposure to greenness. And we found that children who lived in greener areas were more ready to start school when it was time for that. And some of that, the impact was mediated by a reduction in air pollution. So there was a clear beneficial impact. And now, as you mentioned already, I'm in Spain, Barcelona, at the Barcelona Institute for Global Health, and I've been working, for example, at looking at the co-benefits of climate change actions through forest carbon sinks, looking at forests as carbon sinks, and we found that forests that are managed for recreational purposes rather than, say, timber production and so on, are actually optimizing the carbon sink impact. So we get a strong climate change action impact, I'd say, combined with the co-benefits. Clearly, if the forest is managed for restorative purposes, for recreational purposes, then it's also more restorative, and you get the physical activity, health impacts, and so on. And then finally, I'm also working on a project where we're looking more particularly at nature-based therapies. So we're trying to look at how different natural environments, we're looking at urban coastal areas, but urban forests as well, and then more mountainous areas, and how therapies in these natural settings can improve the quality of life and reduce chronic stress among people with metabolic syndrome.
That's fascinating. I think because there's so much to cover here, and we only have a limited time. So what I'm thinking is that both of you have worked on the intersection of urban forestry and public health throughout, the lifespan of a human being, right? You both have mentioned the impacts on pregnant mothers and even unborn children, young children, going up to even, we know that living in greener areas increases the longevity of people as well. So I think it'd be fun to kind of go through, start from pregnancy and go our way into old age and talk about, what the urban forest can mean in these different factions of life. But before we do that, I want to ask you both this question that I feel like comes up a lot when we talk about this, and that is that should the focus now be about, how nature can heal us, or is it just the fact that we have become so far removed from nature and we live in such unnatural landscapes that simply having the presence of trees is not necessarily that's healing us from all these things that are wrong of us. It's providing an environment that does not require us to heal from. Does that make sense?
Yeah.
What do you both think about that? Well, Jeff, we'll start with you.
I think, yes, certainly going back to something which Matilda was talking about, which is the prevention, the health preventing sort of chronic disease is far more cost effective than trying to treat it once it's there. So in answer to your question, creating environments where those chronic diseases are less likely to come up is just far more likely. When you look at as I say, I'm trained as an economist, so when you look at the cost effectiveness of different health interventions, things like public health interventions that prevent illness are far more effective than, say, having a heart transplant or something like that, which are not very cost effective at all. So yes, creating environments where those things don't come up, or don't come up as quickly, or don't come up as often, I think is a really good idea.
How about you, Matilda?
Yeah, no, I fully agree. I think it's an interesting thought you have there. That it's maybe, I mean, and some of the earlier studies showed these things that maybe rather than actively reducing stress, or well, you know, studies show that green spaces reduce stress, but also it improves our inherent capacity to recover. So it's maybe like it becomes a more efficient way for stress recovery. But I think you're onto something there, that really it is that we are immersed, we should be more immersed in nature, and we are currently, and the latest generations are increasingly disconnected from nature is of course a threat, I think. I mean, I remember when I spoke to my daughter when she was 5 years old or something, and I just, you know, I taught all my children that, okay, you must never throw litter in nature. Okay, you know, for me. And then we were standing at the car park, and she had got an ice cream, and she took up the paper and she said, "Can I throw this here, or is this nature?" She didn't even know what nature was. It was like, this is really the thing. It's just an abstract concept for children of today, and I think that's dangerous.
Yeah. Yeah. Oh, kids are so good like that. You know, they show you the most, they show you things through a different lens and different perspective that really get you thinking. And speaking of children, let's start there, or let's start even earlier. Let's start with pregnancy and with babies that are still in the mothers. What impact does the urban forest, or can the urban forest have on them? So Jeff, we'll start with you, and then we'll go to Matilda.
Oh, sure. Well, we know that mothers with more trees close to their homes, and one of the things is interesting there is it's quite close. The biggest benefits are often having trees within 100, 200 meters, so that really close in area around a mother's home, that they have higher birth weights, they're less likely to have underweight children and less likely to have premature children. And that's obviously enormously important right at birth. If you're not underweight or premature, you're much less likely to die or have a health complication at birth, much less likely to end up in a neonatal intensive care unit, which is one of the most expensive parts in hospital, maybe the most expensive place in a hospital. But also to some degree, you put on a different health trajectory for life. So kids who are not born premature, who are not born underweight, they're less likely to suffer from chronic diseases. They're more likely to do better in school. They even have higher lifetime earnings. So it's really like, even before you're born, you can be put on the, well, or thinking the other way around, if kids aren't exposed to trees, the fact that they can be put on a health trajectory that is just lower than it could have been is just sort of tragic. I mean, it's offensive in many ways. So yes, they can really have a fundamental effect on that health trajectory.
And just to follow up there, what do you think, or what do you know, is the mechanism? What is it about being close to the urban forest?
A whole range of things. We know for certain there's likely to be an effect of air pollution, other things like stress management, probably some to do with the microbiome, women being more physically active. And then one which I've started to get more interested in recently is social connectivity. One of the things that we found in COVID, you know, when you have an impact on people's social connections, you can have a profound effect on people's lives. So how greenness can affect social connectivity early in life, I think, is a really interesting one. But it's a whole range of mechanisms, and those probably vary by place and by person.
Matilda, I know you've done some work as well about this early childhood exposure, or perhaps pregnant women exposure to biodiversity, that can have boosts in the microbiome and in immune health. What is the mechanism there? Is just being in the presence of urban forest enough? Do we need to have, you know, kids and perhaps even pregnant women with their hands in the soil? What's the mechanism there?
Yeah, no, I think Jeff is clearly the expert here, so, and it's hard to add much to what he already said. But I think, I mean, the mothers, that is, I would say that is not researched much, whether the impact of mothers having their hands in the soil and whether that would have an impact on the fetus. But we know from studies, and like from Jeff's studies, and from they're doing interesting research in Finland as well, around the children who are exposed to really, they have these fascinating trials looking at composites of soil that is composed of really healthy microorganisms in a very, very diverse setup, so to say. And they show clear signs of impacts on the gut microbiome and the skin microbiome of these children, which then translates into reduced risk of immune system related disorders and such as allergies and asthma, for example. I mean, there's this biodiversity hypothesis that that one of the reasons why we see an increase over the last 100 years, we've seen an extreme increase in allergy, asthma, and other immune system related disorders. And one of the reasons would be that we are not exposed to biodiversity in nature, for example.
Yeah, I think we've all seen those videos of Danish, Swedish, Finnish daycares or preschool centers where they basically have the rule like the kids are outside all the time, rain and shine, and they're just absolutely covered head to toe in mud when they get home. And I think as a mother to a toddler myself, that's like a dream come true for me, knowing what I know. But I can imagine for a lot of parents that are less in the know about this kind of research, it feels like kind of a big step, right? There's a lot of cultures in which children grow up where you want to keep them clean and you definitely don't want them to get their clothes dirty. What can we do to better translate? Because to Jeff's point, having impacts like this, both in utero and as a young child, can have a lifelong, impact of effects. How do we communicate these benefits so that we can change that cultural narrative too? Go ahead, Matilda.
Yeah, okay.
She's ready. She's excited.
Yeah, no, I don't know. I think I don't know if it's if I have a good answer, but I think sometimes we're talking too much about. We clearly need to communicate better, but I also think we really need to change the way our societies are shaped and how our cities are shaped. It shouldn't be so much about communication. It should be like a way that is impossible. It's impossible not to have children in nature. We and to not enforce it, but that outdoor schooling and outdoor preschooling and these things are like evident. It's
the norm. Yeah,
it's the norm. Yeah.
The communication thing is interesting because Matilda went on to the biodiversity hypothesis, which is a kind of narrow statement of the broader hygiene hypothesis. And it's interesting, you hear hygiene hypothesis and you think, the notion that cleanness is good, but isn't cleanliness a good thing? Hygiene has had profound effects on public health, right? So some of it is just how you say it. So there's another way of talking about the hygiene hypothesis is to call it the old friends hypothesis. So you have these microbes that we've been exposed to for millennia. And so when you think of it in those terms, that being exposed to these old friends is a good thing rather than that cleanliness is a bad thing. So some of it is communication, but I completely agree with Matilda that structural change is such that communication would be moot.
Right. So pregnancy, early childhood, let's get a little bit into a particularly vulnerable age group, which I think is preteens and teenagers and young adults. And we know that that age group specifically is dealing with mental health problems, mental health issues at a scale much larger than I think we've seen in generations past. Can you talk a little bit through the urban forest, through that lens of mental health for that age group in particular? Either of you, whoever wants to start.
Okay, I'll start. I've done a little bit of work there with children and ADHD. We see those diagnoses climbing a lot. Whether that is a true increase in there's actually more cases, or whether this is what we regard as ADHD is broader, we're not quite sure. But you see people who are exposed to greenness have lower rates of ADHD. They don't develop at all, and also people who have ADHD, their symptoms are moderated by being in the presence of nature. So that's a really big deal. There's some work on autism, though less than I would like to see. And then obviously we talked about earlier about some of the mechanisms involved in stress, right? Stress is a big mechanism. So anything in mental health that might be mediated by stress, so anxiety, depression, obviously is going to have an impact there. I think just creating those impacts for children where they can be on their best trajectory for life, as we talked about before. So anything that can mitigate stress, I think, is definitely a good thing.
Yeah. How about you, Matilda?
Yeah, no, I fully agree on that. It's clearly, I mean, that was one of the first pathways that was looked at, the stress reduction effect, and it seems to be, it's confirmed study after study that different indicators of stress are influenced by exposure to green spaces in cities and beyond. We also did in Canada, actually, we also looked at ADHD and the reduction of that among children and young people. And we did one study on autism spectrum disorder as well, which also showed a certain beneficial impact of green spaces. Otherwise, I would say, in terms of mental illness, it's important to I come to think often of, but this is impossible almost these days to talk about this kind of things without mentioning COVID-19 and the tremendous impact it had on mental health. I mean, we all recognize the terrible death toll it took, but WHO also estimates an increase of 25% in depression and anxiety, and we know that suicide is the most common reason for death among young people in Europe. It's that's for me, it's staggering. It's terrible.
Yeah.
I think it's the same across the world. And what we did, for example, in Catalonia in Spain, where I'm right now, is that we did a study, because here the confinement was really strict, as you know. People were locked into their houses for months. And so we did a study using a survey among more than 10,000 people, where they were asked about their views just from their homes during this time. And those that did not have any views whatsoever of green spaces from their windows, there was a 2.5 times higher risk of severe clinical depression. And that is really substantial impact. So really talking about small things like just use of green spaces, and I would assume that there's some sort of stress reduction impact, or like being connected to the bigger world, possibly.
I was also something to remember there. Remember the environmental psychologists, the Kaplans, Stephen and Rachel Kaplan, and that notion, the difference between soft and hard fascination, right? So that when you engage with a built environment, you have this hard fascination, and that your concentration will eventually degrade. But whereas if you're looking at a green environment, that fascination is soft and it was actually restorative. So, you know, it's fundamental there. In one example, you're restoring, and the other you're going downhill. So I'm sure that has something to do with that. They wrote, I mean, that was back in the late 70s, I think. The Kaplans were doing some of that work.
Yeah, they were the pioneers.
Yeah, it's really worth revisiting some of that stuff.
Well, I think so too. It's easy to reinvent the wheel. We often tend to do that. Many of these things were dead.
I think what you both said about, and especially what you were saying, Matilda, about even just having the view of greenery. You talked about this, of course, in a hospital setting. But I'm here in New York City at the moment. Got the chance to visit the High Line yesterday, which is a project I'm sure much of this audience will be familiar with. But essentially, it is a converted old railway line that they converted into a massive, linear park. Much of it with now mature, full-grown trees, and it's elevated. Right. So what's crazy is, as you're walking along the High Line, you are able to look into essentially people's apartments, bedrooms, houses, right? And I just think every time I'm there, I just think, 10 years ago, these people looked out at another building, they looked out at a grayscape, and now they're waking up in downtown Manhattan and having a view of a mature tree with birds in it and waking up to bird song. And it just every time I think it obviously just such a unique project. And I'm not saying we could, replicate this everywhere, but it just goes to show that even in the most urban of settings, just the difference that even the view of one tree, I'm sure, has.
Yeah, well, they've done similar projects in Chicago. I think it's the 606 project, and then the Beltline in Atlanta. So those sort of rails to trails projects are real opportunities. I can't remember. I think there was done one in Spain, but I can't remember the name of it.
The only thing that comes to my mind right now is the Bosco Verticale in Milano, the two high-rise buildings that are like forested.
Oh,
The issue with these kind of projects are, of course, I mean, these are for super privileged people. And that's what happened with the Highland, right? That became this gentrification issue. That
yes. Yeah, that's
green gentrification. So that's something that I don't know if we're going to continue talking about that. It's something close to my heart.
I'm sure we have enough arborists in our audience today that are really quite concerned about putting trees on, 25, 30-story buildings, which is a separate conversation we can have.
Totally separate conversation. I do not promote that as what we should do either. It's not the same.
Jeff, one of the I don't know, maybe you said it in an interview. I can't remember where I read it, but I've got it copied and attributed to you in a slide that I use for presentations often. And that is, and I think this is especially, magical coming from an economist, but you say something along the lines of all the other benefits of the urban forest end up being rounding error when it comes to public health. And I think that's so powerful, and I'd love to kind of have you dig into that. And then Matilda, I want to ask you about, what are some of the most powerful public health impacts that you've seen of the urban forest? But we'll start with you, Jeff.
Yep, you're right. I think we have the more intuitive benefits of urban trees, so something like carbon sequestration or temperature moderation, stormwater runoff, the biophysical benefits. And not suggesting they don't exist, and they're a lot easier to kind of intuitively understand. But once you start looking at the health benefits, they're orders and orders of magnitude higher, the health benefits. I did, and also not only are they orders of magnitude higher than those sort of biophysical benefits, they're often orders of magnitude higher than the costs. So I did a study a few years ago looking at a tree planting program, and it had an impact on longevity. So you could then use the US EPA value of a statistical life to compare the costs and the benefits. And I found that the benefit cost ratio for tree planting in terms of human longevity was 1,727 to 1. So it's preposterous. Even those email scams we used to get didn't have those sort of rates of return. So yeah, it's absolutely true compared to some of the other benefits, the health benefits are where it's at. And also, human life is valuable. In consequence, healthcare is expensive, but trees are cheap. And so I think the rates of return here are quite spectacular.
Yeah, I want to get back to that, but Matilda, what would you say is one of the most striking, impacts on public health of the urban forest?
Yeah, I agree with Jeff. There's so many impacts. If I have to pick something, I would say to put it in the context, and we're living in a world of increasing impacts of climate change, right? And we hear it in daily news every day. It's more and more reports on the degradation and the climate change, and what the health impacts are of that as well. That has become more and more clear that we are all affected by it, and not the least through the urban heat island. And we know that this, since many decades, a lot of evidence on the heat reduction impact of urban trees through shading and evapotranspiration. And as of late, more and more studies show that this is directly translatable to health impact and saving of lives. And for example, there is a study published by a team at IS Global, and that demonstrated that if the cities in Europe, that would be the same in North America, I'm sure, had a tree canopy cover of 30%, 1/3 of all the deaths due to the urban heat island could be prevented. 1/3. I mean, and every summer it's like tens and thousands of people dying, and like 1/3 of those could be saved. That's really significant.
Yeah, it really is. And I think you can both relate to this. The unfortunate thing with the urban forest is that from a research perspective, we cannot put it into a petri dish, right? There's so many confounding factors and all these different, whether it's the socioeconomic or whether it's, histories of urban planning. There's all these different confounding factors that make research into the urban forest really quite difficult. That being said, Jeff, you got pretty lucky a number of years back, which I would say is probably one of your most famous studies to date, which was not so lucky for the trees, lucky for you, which was the massive invasion of the emerald ash borer across the northeast of the States and Canada as well. Tell us what you found when you looked at the, I believe it was over 100 million ash trees that perished due to the emerald ash borer. What did you find that impact to have on public health?
Thanks. Yeah, and I think you're absolutely right that untangling that relationship between health, demography, and trees can be really difficult when you're just looking cross-sectionally. So what I was always on the lookout for is some opportunity to do a natural experiment. Can we see longitudinal changes over time in tree cover? And in this case, you can. In that the loss of trees through emerald ash borer, you have substantial loss of trees. And the other thing that's important is that loss of trees isn't correlated with other drivers of health. So it isn't correlated with race or education or income. So what we found is that loss of trees from emerald ash borer were associated with higher rates of both cardiovascular and lower respiratory mortality. And that point, we went out to that study published in 2013, and we went from 2001 to 2007, and we saw an additional 21,000 deaths attributable to emerald ash borer. So a pretty substantial number of deaths. So, since then, I actually managed to do a companion study. So we see that loss of trees were associated with increased death. And then I was able on the West Coast to look at a large scale tree planting program. And I was hoping to see that longevity was increased, and we did. So we found that as you lose trees, more people die. As you plant trees, less people die. So it's encouraging that you see that effect in both directions.
Yeah, I really hope that, it's research like this that really kind of brings us over the edge, that, when people in the audience, might be able to relate to this, when they're in discussions either with municipalities or property developers about why it's so important to maintain the trees that are already there or add new ones in the plan that they have. This is not just about carbon sequestration anymore.
No.
This is something that is so much bigger. Matilda, Jeff says, all the other, benefits compared to public health are rounding error, which I think coming from an economist is such a good way to put it. I think what you've done really well throughout your career, and I think that stems from, having studied medicine and having studied this. Like this is Matilda, this intersection is, you embody this like no other. What do you think that both of those disciplines can learn from the other? What can the medical professional learn from urban foresters, and what can urban foresters learn from the medical profession?
Wow. First of all, I think, it was a long time ago I reflected upon this now, because it was such many years ago I shifted. So, but in the beginning, I really felt that it was mostly the health profession that had to learn a lot from the urban foresters and the ecologists and that sector. And I remember, for quite a while, it was really my mission to try to translate the language try to develop a language that could be understood by both. But I think, yes. So for example, I remember when I started talking about ecosystem services with health, not even healthcare professional, but like public health researchers, and they had no clue what it was, and it was like, it was just interesting. But so what we could learn from each other. Okay, so let me say that I think what we really need to learn is that, we can talk in the context of planetary health, where really understanding that health is not just the health of human beings, but it's also the health of the natural ecosystems on which we all depend. And that critical understanding that needs to come from both sides. I think that it's this interconnection is really fundamental for the life of human beings, and I would say for the planet as such.
And how would you? Oh, sorry, go ahead, Jeff.
I just wanted to really agree with that. What Matilda made that point, that those things are not separable,
No,
and that both sides will suffer if they believe that they are separable.
Yeah.
Sorry.
Yeah. No, I could not agree more. Okay, and if we take that kind of as our basis there, how do we go into municipalities, architects, property developers, utility companies? You know, many people in our audience today, these are the people that they now, after being inspired and listening to this webinar, those are the kind of parties that they now have to convince, right? They've tried for decades with all these, you know, biophysical benefits of trees. Clearly, it's not working to the magnitude that we would have wanted it already. I've always thought that if we could just talk about the urban forest more through the lens of public health, we would get a lot further. How do we communicate this to the audience that's not quite there yet?
Oh boy, I'm going to punt that one to Matilda.
Yes, it's a $1 million question, right? I don't have the perfect answer, but I have some example from, for example, this EU project I mentioned before on nature-based therapies, where we're working with something called resilience hubs. So it's really, we're creating physical spaces for stakeholders from all different sectors to engage and meet and discuss the issues around urban forests and natural environments in general. And so we take stakeholders from the healthcare sector, environment, economy, and education, and really trying to put them together. And it is, I would say, so far it's working well. It's trying to develop a network where they can start understanding each other, and which will then hopefully work more with co-governance and bottom-up approaches, because I think this is really where we need to talk in terms of participatory approaches, also for the sake of equity. If we want to we need these urban forests, we need these urban green spaces really where they're needed the most, which would be in more deprived areas, right? And but to make it really work and not end up with green gentrification, the idea would be to have people really being part of the conversation from start, to have people being part of the planning process. I'm not sure if I answered the question at all, but
yeah, sounds like a big focus on getting, you know, all of the different, it sounds like listening, to be honest, getting a lot of the different stakeholders on board early on, and initiating that conversation. I'm just, you know, what is that benefit on public health that's going to get people listening? Is it the immune system? Is it, you know, I know there's great stuff coming about the increase in natural killer cells and cancer prevention from being around trees. Is it the overall health of our children? Is it cognitive development? Is it the solution to the mental health crisis? Like, what is that thing that's really going to get people excited about that?
I think keep it simple. How about dead, not dead? You know, like it's just longevity.
Effective.
Yeah,
It's a good slogan.
yeah, like, do you prefer one over the other? You know, and so
let me
we can
think.
talk. Yeah, indeed. Well, it depends on the day, doesn't it? But yeah, so that we can talk about. Sometimes our discussions of well-being can get a little fuzzy, but if we talk about some of the health outcomes are profound, being alive versus not being alive. I mean, unless you get rid of those 1 or 2% of people are sociopaths, for the rest of us, that stuff profoundly matters. So yeah, I mean, concentrate on the really obvious stuff that I think the birth outcomes is also interesting. Yeah, do you really, you know, do you think it's, back to what Matilda was talking about with equity, do you think it's appropriate that a baby is disadvantaged in health before they're even born? I mean, that's really kind of offensive. And so, and the evidence for trees and birth weight is pretty unequivocal, right? So we know that. So are we comfortable with that? Surely we're not. And then obviously, you know, different longevity by neighborhood. Are we really comfortable for the cost of a few trees that people are going to die sooner in different neighborhoods? Are we? I mean, I'm not. But so I think that as an economist, I'm often not very comfortable with sort of moral questions, but I think in this case, maybe that's one of the ways to approach it.
What do you think, Matilda?
Yeah, no, I fully agree, and I think it's interesting that you mentioned the thing that are we comfortable with that the baby being born and more disadvantaged than another depending on the number of trees, really, because we know there's no people of lower income live shorter lives. There's
Yep.
no biological reason for that, really, no.
Mhm.
And so this is really something that has to be addressed by social interventions, and so addressing the social determinants of life and environmental determinants of life expectancy. And if we can then translate it to one of those determinants being trees and green spaces, this really to address this appalling health inequalities. I mean, that is, I mean, if you want to for a doctor, the best question you can ask, how, if you want to predict a person's life expectancy, is what is your postal code? That's ridiculous. Unacceptable.
Speaking of being in the doctor's office, I would like to end our discussion before we get to the Q&A or the questions from the audience. So this is also an invitation, audience, to please pop any questions that you might have for Jeff and for Matilda in the Q&A box, and we'll get to those shortly. But before that, can you give us both a prescription for our cities in North America? So based on what you know about the benefits of urban trees and green spaces, what are the top 3 recommendations that you would love to see all cities implement to improve the health outcomes of their citizens?
Well, I think I'm a big believer in making sure that we have tree canopy really close to people's homes.
Yes.
Right. So I think the scale matters here. So we can talk about, oh, we want 30% canopy cover, but we don't need that just to be an average over the city or even an average at the neighborhood level. You know, when we actually get down to the individual block level, you know, can you have, do the branches of a tree scrape your bedroom window? You know, I think that sort of thing really matters. So the very micro scale, I think, matters. Don't get lost in the larger. Those larger sort of targets are really important too, but making sure that somebody can see a tree from their house, you know, so they have that direct contact. So I think, yeah, just keep the micro scale targets in mind.
Yeah, that's a great point. That's a great point. And I feel like that feels also realistic, right?
Yes.
It allows you to think more locally and more tangibly and more realistically, hopefully, not more practically. I like that. How about you, Matilda?
Yeah, no, the distribution is really what I usually talk about as well. That goes down to the local scale. I don't know, you emphasized North America when you asked the question, cities in North America.
For this audience.
I don't know if I dare to say, but can we talk about car-free cities?
Uh-oh.
It's but because for me it's really all right. We have many cities of the cities in North America are really developed around cars rather than people.
Yes.
And I think now with urbanization increasing everywhere and cities are getting more and more dense, it's getting increasingly difficult, right, to find spaces for green spaces and to have parks and street trees. Even it can be complicated. And so to close off streets from cars and replace them with spaces for vegetation, for greeners, for people to, and children and all generations to dwell. I think that is, and the 15-minute city concept, that you don't need a car because everything is available, accessible within 15 minutes walk. I do think that is a concept to consider if possible. And if I want to, yeah. It's something to add to, if you asked for several recommendations there. I think
we need a lot.
I think to consider cities as leaders really in the addressing sustainability and addressing environmental degradation, to consider cities as also hubs for biodiversity, actually, because then we get, if you think in terms of sustainable development, and I think lots of cities do have sustainability plans, climate action plans, etc., to really take that to really incorporate the public health benefits into these plans and actions. I think it's another way to move ahead.
Yeah, to reframe also the role of cities in all of this. Yeah, wonderful. I am going to take a quick look and see if we've got any. I see we've already got some coming in. While I take a second to do that, Jeff, tell us about this new chapter. You have left the USDA Forest Service and you've gone off and created your own company, Ash and Elm Consulting. Tell us about that transition and tell us about Ash and Elm.
Well, it was this was a bit chaotic this spring in the federal government, as you probably all know. And so my wife also worked for the research branch of the Forest Service, and we decided it was time for change. So we've gone into the private sector, and we really are trying to, it's really have a very narrow focus, which is helping people make that business case for urban trees. And the biggest part of that business case is the public health benefits of trees. So that's what I'm trying to do. If anybody wants to have that discussion, please do give me a call.
Wonderful. Well, that actually leads us perfectly into the first question from our audience, which is from some of our friends at the city of Vaughan. And they ask, do you have any recommendations for simple, clear ways to measure or quantify the benefits of municipalities undertaking continuous tree planting? So I guess also through the lens of public health here. So how can they quantify those benefits?
Yep, that's a good question. Like we are clearly interested in these things for monitoring. And what we work a lot around is so-called health impact assessment. And a lot of that is also what Jeff talked about, that looking into mortality, longevity. So that is one way to, as an indicator, really, if you to see if you increase the tree canopy, if you invest in this, if people live longer. That's a very easy measure. Other ways is, I think, to look at also prescription rates. There are, for example, studies showing that in areas where there's tree planting, the prescription of antidepressants in particular are reduced. So that's a clear, tangible indicator, I would say.
Jeff?
Yeah, I think that's absolutely right. I think with the as Matilda points out, the data are best at the beginning and the end of life. So if you're going to look at actual health outcomes, then looking at birth outcomes or longevity, but you can also look at some of the mechanisms involved, like there's some fairly low cost air quality monitoring now. As the tree canopy grows, do you see changes in air quality? You can do some stuff, fairly simple stuff with stress reduction, right? Do you look at heart rate, salivary cortisol, blood pressure, stuff like that? Do you see the changes in how people use those spaces? Do you see more people walking there? Do you see people more exercising there? So I think how people make you, as you change the space, it's, if we go back to that about humans and health on one side and ecology on the other, you are making ecological changes to the human environment, and then people are going to respond. And if you look at that, and I think if you see changes in how people respond to the environment you create, that's probably a pretty good indicator of success.
Yeah, and if you can't figure it out, you can call Jeff.
Absolutely, and I'll call Matilda.
Matilda, don't call me. That's where it ends. We had another question come in, which I think was a really practical one, and that's one that I hear a lot too, and I'd love to get both of your feedback on it. And that is, how can, a municipal, whoever it is, how can someone convince a client to maintain or retain the trees that they already have on a site and not cut them down for a project?
Well, I think
it's
the argument you make, well, the dead not dead is compelling, but it really depends on the situation. So, for example, you need to find out what's important to that particular client. So that client, for example, maybe it's a development project. Maybe the effect on house price matters. And so if you can spend some money to retain them, then the houses that are going to be being built will sell for more. So, for example, that may be important. Not being dead may be important, right? Whatever it may be, you need to find out, because the benefits of trees are so broad. Yes, health benefits are probably the biggest, but they're very broad, and there are still substantial other benefits. And if you can find what's particularly important to that person, then you may be able to, because the answer, whatever the question is, trees are probably going to be the answer. Right. So whatever is important to them, you can probably find that trees are going to have some influence on that thing. So maybe ask some questions first and find out what really floats those people's boats.
Matilda?
Yeah, no, very good points made already, and really context dependent. I guess it would be dependent on also why they would want to get rid of that tree. If it's falling branches, litter. I mean, if it's falling branches, I'm not an arborist, but I guess it could be addressed in a different way, like optimal pruning or something. And allergies, I know, is one issue that people talk about. With trees, you get the pollen allergies. So yeah, for a specific client, maybe that's tricky to address. But we also know that there's many good ways to prevent or to plant trees that are not allergenic, that don't have these pollens that are so allergenic. So that shouldn't need to be an issue.
Well, the classic there one as well is, you remember when we used to say that you had to avoid peanut butter for nut allergies? And that was the thing. Oh, we don't want those allergies. They're terrible. You can't give a child peanut butter because you may get these terrible allergic responses. What's the recommendation now? Expose a child to peanut butter.
Exactly.
And then the same way with trees. So we know.
Yeah.
For somebody who is susceptible to who has developed allergies, then yes, a tree may be a trigger.
Yeah.
But if you expose them early in life to a broader range of trees and plants, then it may stop that allergy even developing at all. So that's
exactly. Yeah. I always come back to that. I always say that. I think the first allergy ever discovered in medical records was 1875 or something. Like, so before that, allergies did not exist. You cannot. No, it's true. It's true.
We invented
them. We invented them. It's a modern disease. So it's interesting.
I am going to pass it back to Rhoda, but before I do that, there is one question which I always also had, and it was an audience member. So I'm going to give you both 30 seconds to answer this question.
Okay.
And that is, how do we pick apart the key driver of health benefits of trees and separate it from the greater socioeconomic status that we typically see in well-treed neighborhoods? So we talked about this a little bit at the fringes, but we haven't explicitly attacked this head on. So what do you think?
Well, I'll quickly start because that's what a big part of what I do. And I think the key there is, rather than looking across space, because there it's really hard to untangle that effect, is looking for cross-sectional change, is looking for longitudinal changes that aren't correlated with demography. So the emerald ash borer thing, or tree planting programs that aren't correlated with demography. So look for longitudinal changes.
Yeah,
fascinating.
Yeah, so it really comes down to study design. Yeah, look at longitudinal changes, or we can do it, address it from research through randomized controlled trials where we sort out the confounders. So, and there are a few studies by now that use that kind of design, that really you get rid of the issue that could be explained by socioeconomic factors.
Yeah, that's the best option. Yeah.
Brilliant. Thank you. This was not only fascinating, we had more than 100 people live, and that's not even including all of the people that are going to listen to this recording afterwards. And I know that there's this huge area of interest in this intersection between public health and urban forest. So thank you both. I'm going to pass it off to Rhoda.
Yes, thank you so much. I just want to express my deep appreciation personally, and our collective appreciation from the members of the Greening the Landscape Research Consortium for joining us today and so generously sharing your expertise. I thought that the entire conversation was just so candid and warm and fascinating. So I know we'll get a lot of calls for the recording for this as well. So Jeff, Matilda, thank you so much. Yeah, I learned a lot. And Nadina as well, thank you so much for moderating today. It's great that it's a subject you're also very engaged in, and it's clear from the way that this conversation went that that was the case. Thank you too to the ISAO for co-hosting today and offering CEUs for those in our audience. But then lastly of all, I want to thank our consortium members because without their work to support all these urban forestry initiatives, this conversation wouldn't be happening. We also want to thank the support from Vineland and the Sustainable Canadian Agricultural Partnership. Thank you, audience, for attending. Excellent questions. Oh my goodness, that really got the wheels turning. I'm like, oh, maybe we should create a document that municipal foresters can just hand off to their public health agencies for better communication. Yeah, it was awesome. So thank you so much for your excellent questions, great feedback. If you are interested in learning more about the Greening the Landscape Research Consortium and the work we do, please reach out. I think Baharak just popped in an email address there in the chat or the Q&A. But reach out. We're always happy to talk and continue the conversation. So thank you all. Enjoy the rest of your day and stay in touch.
Thank you.
Thank
Bye-bye.
you.
Bye.
Bye.
Thank you.